I'm wondering if you have any stories about maybe a friend or a patient or somebody you knew receiving the help they need because of an encouraging friend or acquaintance in their life.
So that's a good question. I can think of a couple stories that might be helpful and encouraging, and they also align with the themes that I was talking about. So people will be ready to make a change when they are ready, and we can help them to come to those conclusions. We can help to gently alleviate stigma and encourage them to access supports, but the timeline will be different for everybody. So, you know, I'll give you a few examples. One person who was a young patient, he talked about how he didn't want to seek treatment, and the only reason why he sought treatment was because his friends came over to his condo and they all took turns spending time and watching him. And they would like play games together, they would joke around together, but they basically took shifts. And this went on for over a week. And it got to the point where he said that he wants to get better for his friends. He's like, I couldn't keep them here. They were taking time off work, they were taking personal leaves, they just wanted to keep me around, and I really refused to go to get help and treatment, and I refused to have them call 911. I told them I'd be really upset with them. So their middle ground was just to keep me alive, was to watch me.
Wow.
And that inspired him to get ready. He was so overwhelmed with like pride and joy. He's like, I have the best friends, is what he said. I have the best friends. Now, not everybody has supports like that.
Sure.
That's why supports are so important. Finding those supports, building them, building those relationships is going to be important for somebody to have a good life. Another example that I can think of is a friend of mine had is a very machismo type. Like we would go to like boxing or we'd go to the gym together, and didn't really wasn't very open to being like vulnerable. Wouldn't really talk much about mental health, and he might allure to things here and there about how he was feeling. And when he finally decided to tell me that he was actually feeling quite suicidal over the last like couple months, and I noticed that he was off, a lot of it was listening to him and spending time validating that none of that makes him weak, right? And but not doing so in a way that was patronizing, because we have to be mindful of, since we're on the topic, we're talking about friends, you're not their therapist, you're not a doctor. So we want to be very careful about the words that we use. We're still talking to our friends at the end of the day. So
Right.
our choice of language shouldn't change. How we approach them is what we want to focus on. Is I want to focus on listening and validating and being genuinely curious. I don't want to use certain buzzwords, like letting him know that he has a safe place with me. That might be very helpful for a client, for example, but for a friend that we joke around all the time, he might be like, why'd you use the word safe space? You sound like a doctor right now, right?
Mhm.
So I might say, this is not going to go anywhere. It's just going to be between me and you, bro. And he's like, thanks, I appreciate that. It's the same thing. I'm
You're
not
still
going
with
to.
your
I'm.
friend in that
You're still with your
conversation.
friend. I'm not going to judge you, man. Come on, I'm not going to judge you. It's like, dude, you lift more than me. It's like, how can you say things like that, that you're weak or you're being a wuss? Like maybe you might joke about that, but it's not something you might hear from necessarily somebody in a professional role in an environment, right?
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca, where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.